Thank you, Sinia. Good afternoon, everybody. It's good to see all of you once again. Today, our topic for discussion is spirituality, and we have Dr. Abhijit Dam with us, who would be the faculty, and he would be talking to us about the same. So, a brief about him. He is currently the medical director. He's working as a medical director of Koshish, the hospice. He's also having an MD in anesthesia from AIIMS, New Delhi. He has a national fellowship in palliative medicine from IPM Calicut, and he's also a certified pediatric palliative care physician. And he has the certification from Hospice for Children, Poland. He also completed his MSc in palliative medicine from Cardiff University, UK. We are so delighted to have you, Dr. Abhijit, with us. Over to you, Doctor.
Thank you. And okay, we'll get along with it. And I believe the participants have already sort of joined. And I'll just start my share screen option.
So you can share the screen.
Yeah. So visible?
Yes, sir.
Doctor.
Yeah, okay. Okay, so this is one topic which I have been dealing with in this particular platform. I think this is my third or fourth lecture maybe on spirituality. So this is something which most of the doctors and nurses are not very comfortable discussing. About the volunteers and all, I really don't know how many of you are actually interested in religiosity and spirituality, but then believe me that these are the things which are most important to a person who knows that he's going to die very soon, right? So if you just reflect back for a second and ask yourself a very simple question. What do you want from this life? Just ask yourself this very simple question. What do you want from your life? I mean, you're free to answer this question if somebody would care to answer. Opinions? What do you want from your life?
Fulfillment.
Fulfillment. Okay, great. Anybody else?
Srinivas says it's the best of myself.
The best of his self. Okay, great. So there could be so many answers, you see. What basically it all boils down to is happiness. We all need happiness. Whatever we do, whatever action, you just think of any action in your life. Whatever you do it for happiness, because that is our true nature, happiness, isn't it? So a person who is being confronted with the diagnosis of his death, or his family members for that matter, who know that he's going to die very soon, and you're going to lose a loved member of your family very soon. For them also, suddenly the things change. Their whole world turns topsy-turvy. And they again go seeking happiness, because that is our true nature. We seek happiness in all our actions. So they again try to seek happiness. And how do they try to seek happiness? They take recourse to religiosity and spirituality most of the time. So this law applies to every individual, bar none. Even if you are not religious, it doesn't matter, but you are spiritual. We'll come to that in detail. It's seldom a medical man has true religious views, because there is too much pride of intellect, and which is very true. Illness is a spiritual event, as I said, that we all seek happiness. And when suddenly that happiness is taken away from us, then we put in all our effort to regain that happiness. by whichever means, So recourse to spirituality and religiosity is one of the means to, get back our lost happiness. Here you see this gentleman who is sitting on the bed. He had carcinoma of the gallbladder, and that gentleman in the striped shirt, this is his son, and his son is offering him a glass of water, and this lady who is out here in the red sari, yeah, she is the daughter-in-law of the family. So they are all sort of the family. The whole family comes together. The bonding becomes more solid at times of distress. You see, and sorry. And in the background, if you see, what are the pictures out here? You have a family photograph, and then you have a photograph of various gods and all. Because all these things together, if you see the picture as a whole, you can see religious figures, you can see the family bonding, everything comes into play. And that's why, this is also a reflection of how important home visits are. The moment you call this gentleman to your clinic or to your hospice and get him admitted to your hospice, this beautiful picture is immediately lost. Because the family as a unit is unique. So this is where a lot of chemistry keeps on happening. And this is the place where meaning making also takes place, right? So this beautiful chemistry which is going on in this picture, this should not be destroyed, because this is the foundation of hope out here. The physician's own belief system, whether spiritual, religious or none, affects medical decision-making consciously or unconsciously. Now, if you again reflect back on the previous picture, and now if you are an atheist, and if you are the treating physician, and if you say that, I don't believe in this spirituality nonsense, I am a very scientific person and all that, and you forcibly get that gentleman admitted to your hospice, then you break that beautiful chemistry which is going on out there. And then the gentleman is subjected to days of torture, further meaning making, and so on and so forth, because that beautiful chemistry can no longer happen out there. Because it was your belief system which forced him out of his so-called secure area into an not so secure area, right? So you have to respect the patient's belief systems, the patient's desires, the patient's wishes, the family wishes following that. And as I said, that if you're very scientific oriented, and if you say that, oh, I don't believe in all this nonsense, then I invite you to look at this this picture. This picture represents the Varaha avatar of Vishnu. I'm just putting it here as an example. And this picture would be maybe 5,000, 7,000 years old. And here, this Varaha avatar of Vishnu is holding up the earth, you can see. Now, if you reflect back, when exactly did the scientific community prove that the earth was round? Somewhere about 300, 400 years back. But if you see now, again, if you focus back on this picture, you would appreciate that it was our ancestors who actually knew that the earth was round 4,000 or 5,000 years back. And that is why still today, geography is termed as Bhu-Gol. Bhu means Bhumi and Gol, that is a globe. They knew it all the time. So if you just say that old literature and old beliefs and this beliefs and practices are just rubbish, then that really doesn't hold water. Because you see, visible light covers only 2% of the electromagnetic spectrum. So what we see as light is just 2%. 98% of the spectrum of light is invisible to the human eye. That doesn't mean that it does not exist. It exists. Only the fact that we, with our limited vision, we cannot see that 98%. So similarly, we don't understand so many aspects of Mother Nature and human existence. Just based on a few scientific principles, we cannot just, make decisions firmly. We need to be sort of malleable. We need to respect the other patients. We need to respect the patients and the family's opinions also, right? So there are so many areas which we really don't know. I was a very strong atheist, believe me, way back till around 2010. And then certain circumstances happened in my life that I was literally forced to, start believing. And it's been a beautiful journey since then. This I tell you from my personal experience. It's a grievous mistake to keep a wall of separation between medicine and religion. The act of healing is the highest form of imitatio Dei. That is the highest form of God, the act of healing. But sadly today, most of the doctors and nurses just treat. You just go and treat the disease. You are no longer healers. And if you reflect back, if you remember those old days, most of you are quite young in this crowd, but then people, who are old enough, if you reflect back on your younger days, when the family doctor used to come to your house, actually make home visits, the family doctor used to come and he used to be treated with great respect. And the family doctor was actually a part of the family. And he used to sit, joke around. He knew every member of the family by name. He used to be offered cups of tea and, sweetmeats and so on and so forth. And whatever little advice he used to give, those carbonative red-colored mixtures, and it used to work wonders. Carbonative mixtures, which are purely, digestive mixtures. They never used to contain any antibiotics or anything of that sort. But those medicines still worked. So how did they work? It worked simply because you believed in him. You chose to believe in him. You chose to train your monkey mind to understand that whatever that family doctor said, that would enable you to heal. So that was a true doctor because he helped you heal. Sadly, today with modern medicine, we have lost that beautiful power to heal. We just have become treaters. We just treat the disease. And this is a picture which I show in all my classes. This little girl, you see, she had a huge sarcomatous growth in her arm. So this little girl, she used to come with her ammi, and she used to come to the OPD and she would never look up at me. So during her second visit, when she came with her ammi, I had also decided, no, at this visit, I have to make her look up to me. So I got this huge box of chocolates and gave it to her. And then both of us sat very quietly. We just sat in quietness for quite some time. And finally, she actually looked up at me and just look at her eyes. And that day I felt that I was seeing God actually. Such beautiful, expressive eyes. And when I started talking to her, I asked her if she felt any pain. And then, you know what she told me? She told me that she feels so bad when she sees her mother crying for her. And all along, I was under the impression that perhaps she is in severe pain or something. So I was totally wrong. My presumptions were totally wrong till I actually spoke to her. And this little creature was more concerned about her mother. Whenever her mother looked at her, her mother used to burst out weeping. So until you let go of who you are, you cannot be what you might be actually. And such is the power of participative medicine, where the patient sometimes becomes your teacher. See, more than 80% of the population all over the globe has religious faith. And if you skip to the last line, some groups emphasize dependence on prayer with advice not to take medical treatment also. There are so many groups, so many little groups out there of people who do not believe in medical treatment, and they believe in prayer. They believe in the power of God. And they are quite well off, believe me. So we cannot be judgmental always and say that, oh, you just praying won't make you better. How do you know whether it will make them better or not? Who are you to judge? Because we ourselves don't know anything about that world. It is only when you start exploring that world, that beautiful and magnanimous world of spirituality and religiosity, that you would understand its vastness. So what exactly is religion? Religion comes from the Latin word religare, which basically means to bind together. So a group of people, so religion is something which is man-made, right? We make it. So say 10 people of us sitting in a group, and we decide, okay, we will form a religion. That is, we will form, so we have certain rules and codes of conduct. We'll follow that, and we will worship this particular deity or this particular structure or this particular guru or this particular leader. And so we form a religion. So religion is basically, it's a structured belief system that addresses universal spiritual questions. So this is corporate, this is group-based, it is structured, it is organized. You have certain rules, certain regulations which you are supposed to follow. So that is religion. Whereas spirituality is something which is inbuilt in us. Spirituality gives meaning and purpose to life. Anything which gives you a sense of meaning and purpose to your life is your spirituality. Spirituality is something everybody has. If anybody says that I am not spiritual, then either he's lying or he doesn't know the meaning of spirituality. Every one of us, bar none, is spiritual. And not everybody is religious. Okay. So spirituality is anything which would bring about a sense of meaning and purpose to your life. Suppose you love your dog. So that is your spirituality. And spiritual values can change over time. Today you love your dog, and tomorrow when your dog is no longer with you, maybe you start loving a cat. So then that cat would be giving a sense of meaning and purpose to your life. Watching nature. So that gives you a sense of calmness and, a sense of connection. So that's your spirituality. So spirituality is not necessarily religion. It can be religion, but it is not necessarily religion. So spirituality is something just like that, inbuilt software in your mobile, which is inbuilt. Without that software, the mobile cannot function. And religion is something which you add on, which you can download and put in that extra programs. That is religion. So you can choose whether to download, what to download, whether to download, or whether to delete. So that is an option. So religion is always an optional thing, but spirituality is something which is inbuilt in your system. Now this gentleman, he had cancer of the lungs, and his problem was that he couldn't be alone, couldn't be left alone even for half an hour or so. So he had a daughter and a son. This is his daughter. Daughter was married off, happily married, and this is his wife in this orange sari. So both the daughter was already married, she was staying away, and this gentleman had recently fought with his son. So after the fight with his sons, the son was now staying away. Now his problem was that he wanted his wife 24/7 next to him. I mean, her physical presence was very important to him. Even to the extent that when her wife used to go to the washroom, she had to leave the door open. He was so scared. And then gradually, over a period of time, we started doing regular home visits and inquiring into his problems. And then we found out that he anticipated that he would not survive for a very long time. And in Hindu culture, during the last rites, it is usually the son who comes and lights the pyre. So he was concerned that when I die, now that I have fought with my son will not come back. So who will light my funeral pyre? So that was his concern. Then we went and, we got hold of his son's address. We talked to him and we brought him back home. And so there was a reconciliation between father and son. And then this gentleman survived for at least approximately 30 more days. But those 30 more days were days of peace for him. So you see, this was a spiritual issue, because he was lacking on something which gave him a sense. He was hankering after something which gave him a sense of meaning and purpose in life. And it was also a religious thing, because being a Hindu, he wanted his son to come and light his funeral pyre. So this was a religious as well as a spiritual issue, which when addressed, his quality of life for the remaining part of his life improved dramatically. Now, religion and religious tradition serve two main prime functions. First is the provision of a set of core beliefs about life events and establishment of an ethical foundation for clinical decision making. Because every religion is bound by rules and regulations. There are boundaries in religion. So what decision you need to make should also be appropriate for that religion in question. Okay. So what is the role of religion? Religion can actually help you cope with stress. 9 out of 10 hospitalized patients use religion to cope. Over 40% say that religion keeps them going, that belief in God or belief in a higher power, it keeps them going. It provides you a sense of support. Remember, just before the results are declared after an exam, you go to temples, you go to masjids, you go to churches, you pray, you promise God, you try to bribe God, don't you? That once I pass, definitely I'll do this and definitely I'll do that. So that becomes your support system. It helps you cope with stress. It acts as a buffer against depression and speeds recovery from emotional disturbances. Try doing it. When you're emotionally very disturbed, go to a religious place. In whichever religion you believe in, you can go to a temple, you can go to a church, you can go to a masjid. Spend time out there all alone and you'll find peace. It is associated with positive emotions and a positive quality of life, related to lower rates of alcoholism, drugs, crime, and actually you have better school grades in children who are religious believers. Because instead of, spending time with your friends or going out, in those, going out to pubs and bars, you would rather go to religious places like temples or churches or mosques. So naturally, you would not have the time to indulge in the social levels. It is related to healthier lifestyles and fewer riskier behaviors. Use of fewer healthcare services. Actually, people who were religious used few healthcare services, lower rates of hospitalization and long-term care, greater marital stability, actually, low rates of divorce, enhanced family relationships, because every religion teaches you certain things. You are supposed to follow certain certain codes of conduct, which in Hinduism they call dharma. You have more social support. People of your own religion would form social support groups, or groups where you can, always go back to them and discuss your problems and so on and so forth. Now the question, does religious attendance prolong survival? Yes, actually, yes. In a study which was published in Gerontology in 1999, older adults, particularly women who attend religious services at least once a week, appear to have a survival advantage over those attending less frequently. So, which proves that if you are actually religious, you will survive for a longer time compared to people who are not religious. And it was statistically very significant, with a p-value of less than 0.0001 for women and less than 0.05 for men. Religion and physical health. If you're religious, you have less stress-related medical conditions like cardiovascular accidents, other strokes, hypertension, metabolic disorders. You have a greater longevity, actually 7 to 10 years of additional life. Makes sense, doesn't it? Rather than investing in very expensive immunological therapies and expensive treadmill and, expensive gym equipment and blah, blah, blah. It makes more sense to go to your temple or church or mosque and join a prayer group, for example, right? This will not only heal your mind, it will heal your physical body also, because now the scientific people sitting in this audience, for you, this is a study which actually showed that 7 to 10 years of additional life you get and lower mortality, published in 1999. It actually slows progression of cognitive impairment, that is lower rates of dementia, less functional disability with aging, and faster functional recovery after surgery. Makes sense, isn't it? Religious coping. So what exactly is religious coping? Efforts to understand and deal with life stressors in way related to the sacred. So the moment you come up with a terminal diagnosis or bad news, and as I said, we are all seekers of happiness. What we want from life, from any activity which we do in our daily life, the ultimate goal is to seek happiness, isn't it? So when we are faced with sudden stress, in order to cope with that stress, we often take recourse to religion. It serves multiple functions like search for meaning, identity, intimacy, control. It is multimodal. It involves behaviors, emotions, relationships. So all this you can find in your religion, because every religion has certain religious stories and fables and examples, which are quite inspiring, and they urge you to follow those examples. For, like, as I said, in Hinduism, the particular code of conduct is called dharma. You follow that code of conduct. So it adds a distinct dimension by virtue of its concern about sacred matters. So this year was one of my patients, and she was quite terminal. And after a few days after this photograph was taken, she passed away. But then I used to spend quite some time whenever I used to visit her at her home. I used to spend time. I used to kneel down beside her bed, and I used to keep holding her hand. And she used to, keep on asking me various questions about religion and what is happening to her and what will happen to her later on. And all these episodes actually prompted me to further explore religiosity. And then I studied religion. Actually, I walked that extra mile. I studied religion and I studied another religion. I studied Hinduism and I studied Buddhism as well. And it was mutually beneficial. helped my patients and it helped me also. It helped me grow. Right. So today I have a broader view of the world per se. And I use that as a therapy for my patients. So it makes sense. So it's all about connections. It's all about how you can connect to your patients, how you can address their fears. So in order to address their fears and all, you yourself need to have that knowledge, that understanding, that patience. You need to have that patience. So understanding that knowledge requires you to study in that particular field. What happened with me was that when patients used to ask me questions about death, dying, things which I, at that point of time, really had no idea of, in connection with religiosity, that forced me to read up books. I did my certification in Vedanta and so on and so forth. And I actually have written books on that and its connection to palliative medicine now. So this here is another lady, and this lady you can see who is holding up that little baby. She, you can see her abdomen. See, it's swollen with a large ovarian tumor with ascites, and there is pedal edema, and she is cachectic. And in this state, she came all the way from Agartala to Calcutta just to be with her daughter. This is her daughter. And at that time, her daughter was pregnant with this little child. So for this lady, for her, she wanted to hold her grandchild once in her lap before she finally died. So that was her wish. And that was a spiritual connection, right? Because she believed that if she did not do that, then her life that would not come to a closure. The proper closure would not happen to her life. So she came all the way in this state from Agartala to Kolkata and spent 4 months with her daughter. And her daughter had requested us just one thing, that please try to keep my mother alive till I deliver. And luckily for us, and the superpower also intervened, we could make her wish come true. Now, what happens? Why do patients seek spiritual help, or why do patients seek religious help? So behaviors that erode a patient's dignity. See, dignity is something which is all that a patient has when he's facing a terminal diagnosis. Because at that time, your money doesn't matter, your your property doesn't matter. What you just have left with you is your dignity. So in those last days of life, if I try to snatch away that dignity also, then there is total pain. The total pain concept by Dame Cicely Saunders, I'm sure you are aware of it. You must have been taught about it. So you have physical pain, you have psychological pain, you have spiritual pain, and you have social pain. So when you're dealing with pain, terminal pain, remember that physical pain accounts for only 25%. Just 25%. And all this huge pharmacopoeia of drugs which you use, that for all these pharmacy companies keep on promoting, use this morphine, use that drug, sustained release methadone, and this, that, whatnot. So many drugs. So all these are targeted just for 25% of the total pain. All these drugs are just targeted at that 25% only physical pain. But 75% of the pain, which is social, psychological, and spiritual, they don't need any drugs. It needs your committed and continuous presence with the patient. It needs compassion. So these things are not up for sale. Companies cannot profit from compassion, can they? So naturally, nobody wants to promote such things. But you see, 75% of the therapy can be provided just by addressing social, psychological, and spiritual concerns. But sadly, all of us are just focused on that 25%. You look up any lecture, if you go to any conference, how many sessions are actually devoted to spirituality? Hardly one session, and that too post-lunch session. So people will come and sleep. But if you now reflect back, you see how important these things are. These seemingly little things. So coming back to behaviors that erode patient dignity, relationships of inequality, or treated like an object or without respect, wishes not honored, that no, I don't want to go to the hospital. No, you have to go to the hospital. Or for a patient who is hospitalized or in a hospice, he says, I want to go home. But you say, no, you cannot go home. Stay for 3 more days. Right? So wishes not being honored. Loss of control over bodily functions. Like till yesterday, I could walk on my own to the washroom. Today, I have to take somebody else's help to go to the washroom, which is a loss of dignity for me. Today, my wife or my daughter or my son has to clean up my feces because I'm so weak that I cannot clean myself up. Loss of the ability to choose. You don't have a choice. Suddenly, you're left with no choice. Dying in pain and in isolation. This is one of the major concerns I've seen among many patients, that they say that please let me not die in pain and let me not die alone. There should be somebody. Or when there is a loss of meaning or purpose in life, that is a state of total despair. That is a state of total pain. So how would you know that a patient has spiritual pain? What are the characteristics of spiritual suffering? Pain, constant and chronic. You're doing your best. You're giving them all possible drugs and interventions. But still the patient says that, no, I still have pain. I still have pain. Insomnia. The patient cannot sleep at night. Presence of withdrawal or depression, sense of guilt, self-loathing, or conflict. He continuously keeps fighting with everybody. He's very short-tempered. He doesn't like anything. He doesn't want to eat, doesn't smile. He doesn't laugh at your jokes. A sense of despair, unforgivingness, a sense of hopelessness. So these are the characteristics, or these are the red flag signs which would make you look for spiritual pain. All of us have universal spiritual and existential need, as I said. The need for love and authentic connection, the need to understand and transcend suffering, the hope to find refuge or a source of peace, and the need to find a meaning in life. Everybody needs a sense of meaning and purpose in life. Now here, if you see this photograph, this gentleman who is sitting on this charpoy, he is now completely blind. And this is his wife. She's also sitting on the charpoy. And she has got frozen joints, literally. She cannot walk, right? So till her husband could actually see properly, her husband used to actually take her, physically lift her and take her to the washroom. They have nobody else. All these ladies who are standing, around surrounding them, they have only come because our home care team had come to visit them. So, but now the husband has become totally blind, right? So the husband cannot see anymore. And the wife, there is nobody to guide the wife to the washroom. So what she used to do, she used to just lift up her sari and pass urine and stool from using these holes in the charpoy. This was the state, right? So suffering and loss of dignity, they contribute to spiritual pain. So what are the principles of spiritual care? Spirituality is an essential component of each person, like I said, and spirituality is an ongoing issue. You have to readdress it over time. So today your spiritual concerns can be something. A week later, it can change. So your spiritual concerns can keep changing. Demonstrate respect for patients' values, autonomy, and vulnerability. Do not impose. Please do not impose your ideas and your thoughts on the patient, because the patient and the family are very vulnerable during this period. So please do not try to impose your own ideas, your own religious, values and ideas onto the patient. Most important is know yourself. Unless you know yourself, unless if I ask you for a glass of water, you can only give me that glass of water when you have water in your own glass. Only then you can give me some. So similarly, you can only love others when you have love within yourself. You need to fill up yourself with love before giving love to others, isn't it? So understanding your own self is very important. Is the first step rather in the process, in the principle of spiritual care. So physician, heal thyself. You have to heal yourself, because you yourself are spiritually yourself. Most of us are still in spiritual pain. Ask yourself, when was the last time that you actually loved yourself? Right? So we need to understand ourselves. We need to heal ourselves. We need to fill up ourselves with love before we can share that love with others. I did my own journey. I walked my mile, and it is time that you too should walk your own mile. So I explored spiritual concepts. I did my own journey. So all of us have inherent spiritual resources. All of us. If you say that, oh, I don't have this, I don't have that, you may say that, I don't have morphine, so I cannot treat pain. But that doesn't hold water, So this, as far as spiritual concerns are concerned, you don't have that excuse. You have all the resources, the capacity for love and authentic connection, to understand others, to transcend suffering, to find a refuge or source of peace, to find meaning of life. All of us can be compassionate creatures. We can share the other people's pain. We can understand other people's pain. We can take steps in our best capacity to help transcend the other person's pain. So this was in Kolkata way back, I think in 2009 or so. I used to go there for home visits in the suburbs. And this was one of the patients. And every time I would get up to, take leave of her, she would hold on to my arm and say, please sit with me for some more time. Please speak to me for some more time. So that connection which you can make with your patient, that sense of that authentic connection, that goes a long way in healing. Here is another picture. As you can see, this young boy, he is also suffering from a terminal malignancy. But if you see the background of the room, see here, you can see a trishul with a red piece of cloth tied in. So you will, if you look carefully, you will always find some religious figures or some religious, symbols somewhere. So religiosity, whether you like it or not, always comes forward, especially during times of distress. So here was another picture. This gentleman, he had CA lung, and he has some degree of superior mediastinal syndrome. See, his face is very puffed, and he's a Muslim gentleman. He was a Muslim gentleman. If you see the calendar out here, see, it's written in Urdu and all. Now, if you take a close-up, see the calendar, it's something written in Urdu. I can't read Urdu. But if you see this packet, here you again have some Hindu figures also. Right? So, during the last days of life, all these things become very relative. It really doesn't matter. It is what the patient finds a source of peace or a sense of meaning within. Whichever source can complete that connection is his spirituality. Now, coming to individual religions, just a bit about individual religions. And this is Adi Guru Shankaracharya. We'll first talk something about Hinduism. And he had said, Jantunam Narajanma Durlabmata, which means that this human life is very precious. He had said, human life is very precious because Hindus believe in birth and rebirth. He said, and Adi Guru had said that amongst the cycles of birth and rebirth, the human birth is very precious because amongst all the living creatures, only the human beings have the power of intellect, power of reasoning, which is good, which is bad. That power, to understand that power, only human beings have. So he said that this human birth is very precious and please make good use of this human birth. Right? Help others. In Hinduism, in Bhagavad Gita, in chapter 8, many things are written about death, what to do during the point of death, what exactly practices you have to do so as to attain moksha. And you have this practice of giving Ganga Jal and all that. So these are certain religious rituals. These are ritualisms which you need to permit because you have no idea whether these work or not. First of all, we tend to, by reflex, we tend to scoff on it. Even I used to scoff when they used to tie those black threads or when people would come and recite a prayer. I used to think that, what are they doing? But today, I have stopped laughing and I respect those people because they are also trying. They are trying to bring about a sense of peace and connection. They are the healers. We are just the treaters, but they are the healers. If you come to Islam, here also it's said, when the believer is afflicted with pain, even that of a prick of a thorn or more, God forgives his sins and his wrongdoings are discarded as a tree sheds of its leaves. Every religion says the same thing. In illness, seek Allah's help with patience and prayer. Increase remembrance of Allah to obtain peace. Ask for tawbah. Give more in charity. Read or listen to the Quran. These practices you can offer to appropriate patients. In Christianity, the same thing. Sin and death are the predicaments from which we seek salvation. Our predicaments are ontological. The cure of this predicament cannot come through human power alone. It's very clearly said. The cure of this predicament cannot come through human power alone, and the power of God can help. Again, pointing out that as a human, you are very limited. You are just a small bit, right? Now, this, what I talked about was spirituality, religiosity, and the goodness of it. There is a flip side, the downside. So, terminally ill patients who are well supported by religious communities access hospice care less and aggressive medical interventions more near death. So this study actually says that people who are more religious want more aggressive medical treatment before dying. Spiritual care and end-of-life care discussions by the medical team may reduce aggressive treatment, highlighting spiritual care as a key component of EOL medical care guidelines. This here is another example. Music therapy is being practiced out here. This lady who is lying on the bed actively dying, she used to sing when she was younger. And this is her daughter-in-law, and this is her granddaughter. And this is our team. This is a volunteer. This is also a volunteer. And we brought in the keyboard and we started playing some Rabindra Sangeet for her. And in the end, this lady, she actually started singing with us. And that was such a beautiful moment. Because singing was something that gave her a sense of meaning and purpose in life. Music can be a very powerful tool for healing, a very powerful tool for healing. Use it very frequently. So how do I do it? How do I actually get to do it? So first you need to recognize the suffering, which is sympathy, respond with feelings of empathy, and then you have to be a compassionate presence. That is, shift from doing to simply being. Presence is awareness and kindness. Every time you go to a patient, you don't have to do something. You simply, if you sit, your presence is itself a source of healing. The patient often feels comforted by the fact that, yes, he knows that I'm not alone. People do care for me and people are here to support me, right? Remain available and present. Please do not abandon your patients. See this here again, this picture was taken in 2009 and that's me comforting a dying patient at home. When physicians deconstruct suffering to its physical dimension, as I told you in the total pain concept, if you just focus on physical dimension, which is just 25%, while ignoring the psychological and spiritual pain, which account for 75%, they not only fail to relieve suffering, but compound it. Bodies do not suffer, only the persons do. Where does suffering lie? What is the seat of suffering? It is your mind. Your mind suffers. Your body just follows the commands of your mind. Body is just the instrument, but your mind is the commander. Your mind suffers. So there are stories galore, and I do a lot of, I've just completed my PhD in death and the end of life dreams and visions. And I love working with afterlife, basically. And that's an ongoing project. But see the look of dread on this patient's face, because she used to keep having end of life dreams and visions. She used to dream and have visions of her dead family members coming and sitting by her side, talking to her. So this was the look of fear on her face. And now you see the look of calmness on her face when she was advised. She being a Hindu, we gave her a Rudraksh mala, and we helped her come to terms with her religion. And now you can see the look of peace radiated on her face. So that is the power of religion. So this was my study, which was published in Indian Journal of Palliative Care. And then I'll give you one quick example. So this was a young child who had spent all his life running from hospital to hospital, non-Hodgkin lymphoma, multiple episodes of chemotherapy. So, and now he was shifted to us. He was very terminal. And his only wish was that he wanted to go to school, because all his life, he never could go to school. And he used to watch other kids going to school. So he said, I want to go to a school. And so we talked to a local nursery school. I knew the headmistress at that point of time. And she said, okay, you can bring him for 1 or 2 classes. And then you see, we got him this huge watch. He's wearing this huge watch on his wrist. And he wanted a tiffin box. So that was a must. So we brought him a huge tiffin box and good snacks. And he had to be carried to the school. He used to sit in the last bench. And there he used to sit and eat his tiffin. And he used to make crayon drawings, because that, see, these were his drawings, which he used to, sketches, which he used to sit and make. Because this is what gave him a sense of meaning and purpose to life. And that was his spirituality. So these little things here, if I give him paracetamol and morphine tablets, that won't help him. So here we had helped him heal. We were not just treaters, we became healers out here. So this I just talked about. This is Dame Cicely Saunders and the spiritual component. So components of total pain: physical, social, psychological, and spiritual. Okay. So I'm already beyond my time. I'll skip these examples. And So this is what all patients basically want from your doctors or from the volunteers or from the caregivers, is to help me physically. Listen to me. That means listen to what I have to say. Listen to my soul. Stay with me. That don't abandon me. Don't leave me. And remember me when I'm gone. Have the heart to remember me. That's it. Thank you. And if there are any questions, I would be happy to answer them.
Thanks,
So,
Dr. Abhijit.
yeah.
If anybody has any questions, please do unmute your mics and speak up. You can also put in your ideas or comments if you have any. Abhijit, please go on.
Yeah, thank you for a wonderful presentation. I really can't agree with you enough how important spirituality is for a patient's well-being. I just wanted to ask you, what if the religious, I think you did mention it, likely that in some religions, they don't, some belief system, they don't encourage people to take medicine also. So in such cases, how do you negotiate your way forward? If the religious belief itself is blocking the treatment path, mode of treatment, what do you do?
See, usually we are in this situation dealing with terminally ill patients. They have already gone through all that the medical treatment fraternity has to offer. And now they are facing their last few days of life. In their last few days of life, it is a matter of their choice and liking as to what they want to do in those last few days of life. Even in their last few days of life, if they have to follow what you have to tell them, then there is loss of dignity, isn't it? So we need to ensure first that there is no loss of dignity, because loss of dignity is the greatest killer. Second is provision of certain physical comfort to him. So there you can sort of negotiate and bargain. You might tell him that, okay, if you take this medicine, then perhaps it will help ease your, pain. It will make you think more clear-headedly. You can participate in whatever ways more fruitfully. So that is how gradually first you take care of his physical pain. Then maybe you can think of increasing his appetite if possible. That way. So it is, but not at a cost of, ignoring or eroding his dignity. So the dignity part, I believe, comes first. But here there is also another concern that the patient should be mentally competent. If it is a small child and he's just scared, and if he's saying no, 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 then you cannot do that. So the person has to be mentally competent. So this actually becomes a legal issue, and it comes under the principle of autonomy. Autonomy is that this is my body and I get to decide what happens to my body, right? So, but while considering autonomy, you should also think of beneficence and non-maleficence. All these things go hand in hand. So this becomes more of a, ethical consideration then.
Right. Thank you so much. Thanks.
Yeah, welcome.
Good evening, sir. Thank you for the beautiful presentation. So my question is, as you discussed that you have studied religion and various aspects of religion. So what are the challenges that you have faced when you come across people who are atheist or they don't believe in the existence of God, or people who have different faith than what you have practiced? If you can discuss some challenges.
See, if you're going to treat an atheist, life is very easy actually. There you can just focus on spiritual beliefs, right? You're not bound by religion anymore, and you just are focusing on what gives a sense of meaning and purpose to that person. what is most important for that person at that stage of his life. Because spiritual values will keep on changing. So today it is something, today he says that, I want to be comfortable in my armchair with a, tumbler of whiskey by my side in the evenings. So fine. 1 week later, he might say, no, I want to, have my pet dog by my side. So that's fine. So addressing spiritual issues is not very difficult, provided you know the game. But when it comes to religion, because now religion, as I said, has boundaries. So those boundaries, and the thing about religion is that, like you, in a family, in a society, you have the macro culture and the micro culture also. So, like, say you're a Hinduism. So in your mohalla, for example, in the street where you live, so they follow a Hinduism practice, for example. But in your own house, you might have some special practices. Like, for example, you might light up a diya daily in the evening, which the rest of the houses don't do. So your own microculture would be different from the macro culture of the society. So when it comes to religion, there are so many narrowing downs. It is just like a, glass of, wine, sort of, it's conical. So above it looks broad, but then when you start going down and down, it becomes more and more conical, and at the end comes a particular personalized belief system of the patient per se, right? So that is how you need to see it. So you need to be very broad-minded and open-ended. Okay. And as far as other religions are concerned, I usually, when I go to see patients who are of some religion where I have no idea whatsoever, I gently tell them that I really have no idea about this particular thing. But if you want, I can find out, or you can consult your local, local priest or whoever is there. So it's best to leave it in the hand of experts rather than to give fancy advices on which you have no idea whatsoever. So I hope that answers your question.
Yes, sir. One more question, sir.
Mhm.
When exactly do we come to a topic of spirituality, sir, while we are looking after a patient with terminal illness?
When do we actually look
Address
at?
yes,
You
spirituality.
address it right from the beginning. The moment you step into a patient's house, for example, you might be taking off your shoes and then going to the patient's house. So that is where you start respecting the patient's culture,
Yes.
the culture and the social norms. The moment you do namaste or wish the patient, good morning or good evening, or so you do salam alaikum, and then gradually sit down, or you don't barge into the inner chambers of the house. That is where you begin. You're already practicing the your social norms. You're practicing spirituality. You're practicing religiosity right from that point of time. And believe me, every action of yours is noted by the patient. The patient is watching your face while you're talking. The patient watches your face, watches your eye movements, and your communication is basically, 80% of your communication is non-verbal. So how you communicate, what is your body language, and what message, what vibrations you're giving out, that is perceived by the patient and the family members also. So that is the point where you are already practicing spirituality, your own spirituality. That is why I said knowing yourself is very important. That path of knowing yourself, the path of going into the spiritual world is very important, because that is how you learn humility. Unless you have humility, you cannot be compassionate. Right? Compassion is something which cannot always be learned. Compassion is mostly like spirituality. It is an inbuilt software. You just have to let it bloom. We all have that lotus bud within. We just have to let it bloom. So spiritual things gradually come up. The way you talk, say the patient says, no, I don't like food. And then you ask that, okay, would you like small bites of something which you really like? What do you really like? And then maybe he will recall that, yeah, my mom used to make this kheer for me when I was a little kid. And then maybe you can bring in a small amount of kheer for him one day and give him a spoonful. And like, these are the ways. I mean, these seemingly little things, or, you know, with the patient is trying to struggle to sit up, you offer him a hand gently, sort of half cuddling him and help him up on the bed, and gently lay a hand on his shoulders. So these little signs are perceived by the patients, and that is where your healing process starts. And he will come out. I mean, all the spiritual issues, the spiritual pain, this religious pain is all bottled up, corked up. The moment the cork is loosened a bit, it will just come flowing out. You just have to wait for the right moment to, you know, collect all that is flowing out. I hope that answers it.
Thank you so much, sir. Yes.
If there are no more pressing questions, maybe we can move on to the case presentation. And following that, we can move on to the discussion. Sananda, please take over. Abhijit, do you have a question?
Yes, I had two quick ones. If what has been the progress in India so far in recognizing the spirituality as a form of treatment? Have there been any hospitals that have actually opened up to this option? And also the second question is, wouldn't it be a good idea for people to have different options of religions to follow in their end time care, because they can, as you pointed out about that Muslim gentleman, so that they can decide which which download works better for their software. Right?
Yeah. 2 years back, I had started a national body called the National Association of Palliative Care for Ayush and Integrative Medicine. This was with the basic idea so as to integrate all those specialities which are so-called looked down upon basically by modern medicine, like spirituality, religiosity, and Ayurveda, Unani, all this. So integration, we need an integration because we are dealing with a human being. So that was a way forward. And I had about 5 years back, I had written a small handbook on basic Hinduism for practicing doctors, a copy of which I had forwarded to the MCI, Medical Council. At that time, it was the Medical Council of India, with a request that this should be, touched upon lightly in the curriculum. And because I just had an idea of Hinduism at that point of time, and with the advice that other religions also, something so that the doctors get an idea. But sadly, till date, I have got no reply from that end. So that is still a lot to do, and the endeavor should be on. So that is how I see it. So
yeah, the second question was, wouldn't it be a good idea for people to have options of different religions to follow towards the end? Just like you
you
pointed it
can.
about
I mean,
can that?
see, here there are two things. One thing is that people, if they want to follow any particular religion spontaneously, then it is fine. But otherwise, what happens is that people during the last days of life, and even their family members, they become very vulnerable at this particular point of time. So we should, at this time when they are very vulnerable and fragile, we should not be imposing some religion on them. Just because I am comfortable with this religion doesn't mean that I impose my views on them. If the patient wants to choose any religion spontaneously, or if he has a question, or if he has whatever, so that's fine. That is totally their wish. So we have nothing to impose or this thing. We can just be facilitators at the most.
Thank you.
Hello.
Yes,
Hello.
please go on.
Yeah. Uh, Sir, I just wanted to ask, how do you view this which practice of witchcraft with palliative care?
Okay. You use the term witchcraft. I would,
Yeah.
I am strongly against that term called witchcraft
Oh,
because
okay.
I categorize it under ritualism. It is a ritual, right? So everybody at some point in our life, we follow some rituals, like getting up in the morning and having a cup of tea. That is a ritual. Eating your breakfast at say 8 o'clock in the morning. That is a ritual. So similarly, if a patient goes and offers namaz 5 times a day, that is a ritual. Going to church every Sunday, that is a ritual. So ritualism is an integral part of everybody's life. So similarly, the so-called what you say witchcraft, that is also a ritual. Like offering Ganga Jal to a dying person is a ritual. Offering Tulsi Patta to close the eyes of the dead body is a ritual. Tying the toes together of a dead body is a ritual, right? And similarly, healing, or if you what we call jhad folk and all, with a witch, so-called witch doctor, as you said, witchcraft, or a local tribal man coming in and doing some puja or tantra mantra, whatever you say, or all religions have it. So that is also a form of therapy. You are nobody to, by you, I don't mean you as such. By you, I mean the scientific community. The scientific community doesn't have any business to exactly say that, oh, this is wrong and only I am right. No, you cannot say that, because the power of the mind is phenomenal. Here, by the so-called, the term which you used was witchcraft. By the so-called witchcraft, you're not targeting the physical body, you're targeting the mind. Because the mind believes, the mind wants to believe. So let it believe. And if that mind is under the control of the patient, that is the patient's mind. He wants to believe. He is looking for hope. Let him. This is my take on it. I hope that answers it.
Yeah. So I just wanted to know, since you are a doctor, can you share your experience dealing with different religious patients during COVID?
COVID
How
times,
do you dealt with that?
COVID times were difficult, and people died really lonely deaths, very lonely, and but thankfully it was not physically painful during the COVID, because the virus attacked the brain in such a fashion that most of the sensory input to the brain was cut off. So even that's why the term happy hypoxia was used, that the patients, even when they were seemingly out of breath, they didn't have that terrible sensation of drowning or anything, or suffocating. That didn't come very much, although they were tired and everything. But still, it was terrible for the patients, for the families. Very difficult times. We used social media most of the times, because we couldn't be physically present all the time, and plus using that dress which alienated us. How do you, I mean, like this whole thing is being done on a social media, on a using electronic media. But I would have loved a class, where physically I could have seen you, as a person, your body language. Maybe I could have, shaken your hand, and that would have made communication so much better with you. So sadly, that is being lost the moment we use this electronic media. So it's all human connection. It all boils down to human connection somewhere, And the moment that you cut away human connection, things start going haywire. The moment you start playing with Mother Nature, things start revolting. And as I said, that Adi Guru, what he said, that human ban jantunam nara janma durlabh mata, that human birth is very precious. Make the best use of the human birth. So that humanity thing is very important. Thank you.
If we can hold on to the questions for a moment, we can move on to the presentation, Sunanda. So to introduce Sunanda has been, I think all of you know her already. She has been working with Pallium India as the regional coordinator of Central India. So over to you, Sunanda.
Thank you, Manisha. So very good evening to all of you. And before I go ahead, I want to really thank Dr. Abhijit for that wonderful, enlightening and empowering, I'll say, because it's so, I mean, I'm sure everybody in this platform would have, related very well. So his slides were really heart touching, and thank you once again, Dr. Abhijit. So I move, and as a student of this course, I have been given the assignment to present one of the case. So I'm here. Sinya, will you please go to the next slide, please? Yeah. So just to give you the overview of the patient that I'll be talking about, her age is 45 years, she's a female, and she was diagnosed with CA breast, and her occupation is she works in a NGO sector. So talking about her medical history, she really doesn't have any major other health issues, and currently she's going through the chemotherapies. Okay, so let's discuss about a little bit about her and her family. So coming to the diagnosis, she is, as I said, CA breast, and she is completely aware of the diagnosis and the prognosis, and she is quite well educated, and she took interest to know. So, and the doctor has told her everything. In her family, she has 2 children. She's a single mother, and family also knows about her diagnosis and prognosis. And as I'm just insisting that she's a single mother, so her basic support, main support group is her parents. So now coming to the prognosis, chemotherapy is being done, and it is continuing right now. She's aware about her treatment, as I said. She's educated, and she is the decision maker. I just want to focus on this point and tell that she takes the decisions. And family also, when I say family, it's her parents I'm referring to. Family knows about the prognosis and diagnosis, and to that extent, like she has spoken about it to her children as well, so the children also then know. And coming to palliative care, it's a sad thing that she's not much aware of what palliative care is, and she mentally remains quite disturbed, and most of the time she feels that she wants to be lonely or cut off. She doesn't want to speak to much people, and as I said, she is not aware of palliative care. Children, it's very obvious because mother is ill, and she's a single mother, so they're more attached to their mother, so they're quite stressed out and always anxious, and family also do not know anything about palliative care. So here, I just want to explain the family overview in a pictorial form. So father is a retired person, mother is a housewife, and age is 75 and 70 years. Then she has got 2 sisters, and her husband is in service, 48 years, and she's 45, and she's also in service, like she's a working lady. And she's got 2 kids, one daughter who is 13 years old, and son who is just 8 years old. Both of them are studying. Coming to the eco map, like this is, as you can see in the center, patient. So the lines actually depicts the kind of relationship she has. The strong lines, the bold lines show that she has a strong bond with her parents, children, and family and colleagues. And the dotted line says like it's not that good, just weak, like siblings really don't support too much, and religiously, as I said, she is a weak that. And the single line is that, like, okay, she has got a little support from the extended families and relatives sometimes. And the curved ones depicts that she has a stressful relationship with her husband and in-laws. So coming back again to little bit elaborate about the family. She is a working woman living in an urban setup. Husband they do not live together. And as I said, daughter is 13 years and son is 8 years. Both are continuing their education. They're completely dependent on mother's care and attention. And she's not financially supported by her husband, though she is earning herself, but she doesn't have any kind of support from her husband. And her parents are her only support, as we can see. Coming to socioeconomic situation, she's educated, she's got the capacity to earn, but after the diagnosis, she's become really, really mentally weak. I insist on mentally because I know, like, physically it's there, but mentally she's broken. Actually, she's shattered, and the only, I think, worry right now for her is for her children's future. Like, she keeps worrying about what will happen to both her children. And sometimes she goes for work, sometimes she cannot because of the treatment. So it's like a mix of like, sometimes she's at rest for treatment and sometimes she goes. So looking at the total pain concept here with this case, coming to physical, so she does have side effects of the chemo. So a lot of physical pain is there. Psychological, we can see that she's stressed and anxious about her children's future. So coming to socioeconomics, she's always under pressure and thinking about how she can have a steady source of income, because definitely treatment is taking a lot of money away. So coming to spiritual, she's always insecure, apprehensive, and she has a feeling of helplessness. So now, after going to this case presentation, the questions that we can, discuss is that how we can address the patient's palliative care needs, and who can be the first point of contact for this patient with whom we can talk about her palliative care needs. And how do we deal with a patient like this who's unable to share? Sometimes, as I said, she was like aloof, she wants to stay cut off, doesn't want to speak. So we need to find out how we can make her discuss or share openly rather than staying aloof. And how do we do to add a meaning to her life? So these are some of the questions, so we can just discuss. Manisha, over to you.
Thank you, Sunanda. Dr. Abhijit, if we can move on to the questions and address each one, it would be great. So if it is in relation to the session that we had right now, so what do we do in order to add a meaning to our life? She is, as expressed by Sunanda, the patient is completely hopeless and she has no idea how to move on with her life. So what exactly can we do to add a meaning to her? Does anybody have any comments on this presentation?
I think anybody can help us to find out the answers.
I mean, the first one, how can we address the patient's palliative care needs? On that, some inputs that I have is, like Sunanda mentioned, that she, as a patient, prefers to be, let alone, like she doesn't want to have anybody interacting much or asking questions, and, whatever it is, like probably she's, one thing she may be going through that, like, why is it all happening to me, and all those many questions that anybody could have. So I think she needs somebody, I mean, as we learned in the previous lessons or classes, is, I think the primary need here is to somebody to build a relationship. I mean, in a trust relationship, basically, to start the palliative care. And then how do we start it? If she doesn't even want to meet in the first place is a challenge, but that probably is the first step. Maybe, I don't know, like maybe talking to her parents first, and then maybe parents can become a channel of introducing that person, and and then maybe with her children's and support and so on, and it could begin. That's what my suggestion or input is in that case.
Thank you, Sajjan. Yeah, I do feel the same way, that we need to get hold of a channel to influence her, kind of like to tell her that we all are there. Yeah, thank you.
Dr. Abhijit, would you like to add in something to this case? Something that we should be looking into specifically?
Here we also need to determine what exactly gives her a sense of meaning and purpose to her life. And meaning and purpose. So here I think it seems so from this that her children are very important for her, and somewhere she would be worried about the future of her children. So that is an area which would, if addressed, she would immediately become sort of connected, and she would gradually open up. So that so either you go through the channel of the parents, or you could also bring up the issue of the children and how you can help her. But before just bringing up the issue, we need to do some background homework in terms of, like, you should have an idea of what best can be done to the children, or are there any child shelters, or are there any scholarships available, some sort of idea, so that we should sort of discuss it with the social worker before going ahead. So we go with some offerings rather than going empty-handed. So this is what we have to offer. And then because this is one channel she would be sort of open to. This is all very, what I'm talking is very theoretical. Practically, once you go down to her house, things may be totally different. But giving the theoretical picture out here, so this is how I see it. So this is either go through the parents or go through her sort of children's needs being addressed. And that is where I believe she would open up, because that is one area where a single mother who has two children who are dependent on her would definitely look out for.
Thank you, sir.
Thanks, Dr. Abhijit. Is there anyone else who would like to comment on the case? Or
Sunanda, is it a, real-time case that is currently?
Yes.
Okay.
Yes. It's a real-time case. Yeah.
Okay. And then based on the diagnosis, like what stage is she at? Like usually is it an early stage or anything like that?
Yeah, I think second stage.
Okay. So I'm not at all a medical background person, but if I understand based on whatever knowledge I have, in other words, in this case, like for any other cancer or breast cancers, there is a chance, right? Like now, let's say even take 50-50 chance. So, instead of looking at it completely negative, maybe we can give her hope that yes, there is, there is a positive outcome, or a result that could happen from this treatment also. So giving her hope to the patient can also probably help her to open up and come up. Yeah, because for any treatment, for any illness, what I understand is that if the patient is positive, like not giving up, that helps them to recover even faster. When they give up, it is like, again, that psychological emotional area where they just give up, and then it is difficult for the treatment to work as such. So I think she has to be revived in her whole emotional part, or in psychologically, that yes, there is positive chance, there is people are there to working to support me or to help me, treatment is available and so on. And so that could also help.
So yeah, thank you, Sajan. Here, I just want to, I think there's a need to mention that she's my friend. So even like talking to me, she doesn't feel, though I know that she's a very, very jovial lady and she loves to speak and, keeps chatting. But this diagnosis has totally changed her personality. So whatever I could, after a lot of pampering, I could get this information over phone. She doesn't want to meet anyone. So, that's why I'm being part of Pelham India, and I'm looking after palliative care, this kind of like as a regional coordinator. So I want to really help her. So that's how I thought of choosing this as my case presentation. So if I can just help her somehow. Thank you.
Thank you, Sunanda, for this wonderful case presentation. Thank you to all of you who have put in your inputs. If there are no more questions, Dr. Abhijit, shall we wind up the session?
Yeah, we can, but as far this case presentation goes, I mean, that lady would perhaps need her time also. Everybody needs their own time and pace to start absorbing the shock and the various stages of bereavement if you go through. So denial, anger, bargaining, although they would not necessarily come in a same sequence. But then you could also offer her, for example, if you can offer her my number if she wants to talk. Maybe she doesn't want to talk to you because she knows you personally, perhaps. And maybe me being an unknown person, maybe she could text me or whatever it is, that sort of thing. Maybe you don't want to talk, but then your emotions can be written down. That sort of thing also you can explore, sort of, because the first message from her would be the first step towards her healing.
Yeah. Thank you so much, doctor. If I can
Yeah.
have your number, that would be great.
Yeah,
I'll try my best.
I'll put it in the chat box.
Sure, sir.
Dr. Abhijit, if you don't mind and if your bandwidth allows, would you like to show your face to everybody so that?
Oh, my face, not a very exciting one, but yeah.
Thank you so much. Thank you so much. It was so great having you with us. Thank you for taking us through the path of spirituality and religion. Thank you for letting us know your insights and your understanding about things, and letting us reflect on how we should be dealing with certain things and how our emotions and everything can be managed. So thank you once again for sparing your time for us. Thank you all of you for being wonderful participants and participating and putting in your comments to the session. See you all in the next session. Do fill in the feedback form before you leave the session. Thank you. Bye-bye.
Thank you all. Thank you, Dr. Abhijit. And I have a request. Kindly share your case presentations because we are ending likely to end the sessions. Like it's the 13th session. So we have a few more sessions left with us. So that is mandatory to share a case presentation, whether it doesn't matter whether you have presented it or not. So kindly do share it. Thank you all. We'll see you on the next session. Bye.